Hi, my name is Georgia. I'm here at Nature Baby today with the collab with SALA. I'm a nutrition consultant specialising in pregnancy, postpartum and babies, and I'm a chef by trade and a mama to my boy Odin. So today I'm going to share some tips and tricks for starting solids. So I've written down some of the top questions that I get asked, so I thought I'd just run through them and answer them to try and make the transition a little easier. So when do we start solids? So the recommendation is to start solids at 6 months, but even more important than your baby reaching that age is that they've met all the developmental signs of readiness. So there are 3 developmental signs of readiness that we want to be looking for. So the first one is, has your baby lost their tongue reflex? So this is a reflex that babies have as a protective mechanism to protect them against choking. Most babies lose it at around 4 or 5 months, but if you did start solids when it was still present, they probably wouldn't eat a lot because they'd just push it right back out, and it could be mistaken for them not liking a food. So the second and most important developmental sign is, can your baby hold a seated position for a period of time? So this is just a really good indicator that the digestive system is developed enough to start moving food through the body. So they might still topple over a little bit, but we just want to be seeing that they can hold a position for a period of time. The last sign is baby willing and eager to participate? So often babies show willingness, or they show an interest in what we're eating at around 4 or 5 months. So this can often be mistaken as being ready to start solids, but it shouldn't be taken into account until the other developmental signs are met. So if your baby is showing an interest in eating what you want to eat, you can still include them in meal times. There's so much more to food than just nutrition. There's a whole social aspect, and we really want our babies to witness us enjoying food and seeing how to behave at the dinner table. So you can sit them up at in a high chair, and you can give them some baby safe spoons and bowls to play with. You could give them some frozen milk, breast milk formula, whatever, in a silicone feeder, and they can practice bringing food to their mouths. Those are some tips to include them in the mealtime. So if you do offer food too early, it can actually cause a lot of digestive discomfort and wind pain and things like constipation. So often babies start waking up a lot more at around the 4 or 5 month mark, and parents think that if we offer them solids, it's going to help them sleep. But unfortunately, it's just not the case. They're actually probably going to be awake more because they'll have digestive discomfort. So the next question is, what time of day is best to offer? So I like to recommend after the morning nap, because if you wait too long in the day, then they're just going to be too tired to want to get involved. I think it's just too late to include something new. So after the morning nap is when I recommend. So I'd recommend offering a milk feed when they wake up, and then waiting about half an hour to an hour to offer solids. So we don't want them to be absolutely starving, because they don't yet associate solids with filling their bellies, but we want them to be hungry enough to give them a chance to show an interest in what we're offering. So a question I get asked a lot is, how much should my baby eat? And this is a bit of a trick question, because there's no right or wrong answer. So we want to think of solids more as time to offer, not time to feed. So it's completely up to baby whether they eat anything at all and how much they eat, and it's just our job to offer. In the beginning, in the early days, it's totally okay to skip a few days. Every other day is fine. They might only eat 1 to 2 teaspoons, and this is absolutely fine. And they probably will move to more like 2 meals a day, closer to the 8-month mark. Next question is, when should milk feeds decrease? So milk feeds are really gradually going to decrease over time as solid food starts to take priority, but milk feeds should still remain the top priority until baby is 12 months of age. That just means there should still be at least one milk feed in every wake window until around the 12-month mark. So how can we keep our babies safe? So we want to make sure that our babies are sitting upright in a high chair, not limp back. This is just to help prevent choking. I think it's also really important for parents to know the difference between gagging and choking. So gagging is so normal. A baby's gag reflex is actually further forward than an adult's, and it's not going to move further back until they're closer to 9 to 12 months of age. Yeah. So gagging is dramatic and it's loud and often won't faze your baby. It's just really worrying for us to witness. Whereas choking is completely silent, and that's when there is a complete blockage in the airway. So this is what needs immediate medical attention. So I recommend that parents do a first aid course just so that they are equipped with the knowledge of being able to identify the difference and know what to do if there was a situation. So I love the account Tiny Hearts Education. They have an Instagram account and they offer some really amazing online first aid courses. What is the best method? Baby-led weaning or purees? So personally, I don't believe that there is a best method. It's just whatever feels right for you. I think there's a lot of hype around baby-led weaning, but it can cause a lot of anxiety for parents. So personally, I loved a mixed approach. It worked well for me because I would offer a puree and then I would also offer some finger foods that I felt really comfortable with offering. So there are pros and cons to both. So baby-led weaning is amazing for babies developing their pincer grasp, to assert independence, really good for regulating their own appetite. But purees are a really good way to cram in more nutrients. That's why I don't think that there is a right or wrong answer, or a best method. So with either approach, we want baby to lead. So we want to feed babies when they're engaged, when they're leaning into the spoon, or and we want to try and avoid feeding babies if they're really distressed and they're screaming, because we just want meal times to be associated with being relaxing and fun and not to be associated with stress or anxiety. We also want to let babies get involved, so put some on their tray, let them get a little messy, let them explore, and we'll try not to keep wiping their faces or they're just going to get annoyed. So if you do decide to go down the baby-led weaning path, the finger foods should be finger length, width, and they should be soft enough to be squished between the roof of your mouth and your tongue. So we want to think really overcooked veggies, braised meats, things like that. Removing pips, rinds, and avoiding stringy foods like green beans and celery. One of the main issues with baby-led weaning is that parents are often really nervous to offer meats, and so there's a really high chance of babies being iron deficient. So that's why I love the method kiss feeding. So it has been used in many indigenous cultures for centuries, well before blenders were around. So it's literally just like mama bird feeding baby bird. So it's when we pre-chew foods like meats and give them to our baby. So our saliva actually creates immune boosting benefits, really similar to breastfeeding. So when we're starting with purees, we want them to be a really smooth, runny consistency, because babies will often slurp it off the spoon as if it was milk, and if it's got too many chunks or lumps, it will just cause excess gagging. And if you are choosing to do purees, I would just recommend offering some finger foods by 9 months of age, so they can learn what it feels like to have different textures in their mouths and really learn the chewing motion. How do I introduce allergens? So there are top 9 allergens that are responsible for 90% of allergic reactions, but you can be allergic to anything. But these are just the top 9 allergens. So they're eggs, tree nuts, peanuts, sesame, fish, shellfish, wheat, soy, and cow's milk. So the World Health Organization recommends that we introduce the top 9 allergens before a baby is 12 months of age. So this can dramatically decrease their chance of developing an allergy later in life. All allergens need to be tested separately with at least 3 exposures to rule out an allergy. So that means you'd offer it with foods that they're already tolerating really well. You'd offer it and then wait a couple of days, 2 to 3 days, offer it again, and then 2 to 3 days and offer it again. And if there's no reaction, you can rule it out as an allergy. If a reaction happens within 2 hours, within minutes up to 2 hours after consuming the food, this is things like swelling, difficulty breathing, rashes. This is when immediate medical attention is required. So you must call an ambulance and not offer the food again, and your GP will help you with what to do next. But things like, if a reaction was to occur from 3 hours up to 3 days after the food, this is things like eczema, constant stuffy nose, bloating, diarrhea, then this is most likely a sensitivity, and this can be resolved through a gut healing protocol. So now for the fun part. What should I actually feed my baby? So I've got some fun facts for you. So the first one is that babies require more iron than an adult male. That's why I absolutely love liver as a first food. It is like gram for gram the most nutrient dense food on the planet. I know it can be a little daunting to incorporate liver if we didn't grow up eating it, but chicken liver is really mild, and you can pan fry it and then puree it with some bone broth. You can keep that in the freezer to add to vegetable puree. You could offer that straight on a spoon. You can also buy liver capsules if it's just too daunting, so you can mix that into purees or roll finger foods in it. We also want to offer iron sources that are really bioavailable and easy on the digestive system. So that's why I don't love fortified cereals and things like that, just because they're not that bioavailable and it can be really hard for little babies to digest. So we want to offer heme sources of iron, which are iron from meat products. My other fun fact is that a baby's brain is actually 60% fat, and it's growing at a rapid rate in these first few years of life. So omega-3 rich foods are really important for babies. So ones that I love are things like soaked chia seeds, sardines, but sardines are an allergen. Spirulina is great. Also contains some iron, and I love cod liver oil. So cod liver oil has been used for centuries for immune health and cognitive function. You can offer it from 6 months. It's amazing for babies and mums. Fat should be a high priority. So we want to be using healthy fats in liberal amounts in our babies' meals. So healthy fats are needed for our bodies to absorb nutrients from other foods. That helps to aid digestion, helps us feel full, and helps to prevent constipation. So some healthy fats that I love are things like avocado, coconut cream, egg yolk. So egg is an allergen, but I recommend starting with the yolk. All the nutrients are found in the yolk, and it's a great way to make a complete meal for baby. You can stir yolk straight into a puree when you're heating it up. You can pan fry it to make a little omelette. You can offer egg yolk from 6 months, and it is really great for little babies. I love bone marrow, hemp seed oil, coconut oil, olive oil, butter, all those sorts of amazing nourishing fats. I also love bone broth for babies because it's really rich in gelatin, which is amazing for our gut health. I love bananas, it's a baby favourite. Also other nourishing veggies like kumara, pumpkin, broccoli, cauliflower, all that sort of thing. Probiotic rich foods are also really important. So probiotic rich foods are one of the best things you can do for your baby, as 70 to 80% of your immune system is found in your gut. So it's really important for baby's well-being that we do incorporate some probiotic rich foods. So I love sauerkraut brine. You can offer just the brine. You can pulse up some sauerkraut and stir it into purees. Clover ferments tonics are wonderful. Coconut kefir. We also don't want to forget flavour. So baby food doesn't need to be bland. So we want to be creating adventurous eaters. So you can include some gentle spices like cinnamon, ginger, cumin, some fresh herbs, things like seaweed, Not only are these delicious, but they're also incredibly nourishing. Can my baby have salt? So we do want to limit salt as much as possible, but this can be tricky if you're adapting a portion of your meal to serve to a baby. So a little is not likely a concern, but we just don't need to be like seasoning with extra salt. Should I offer my baby water? So yes, I think small sips of water are really important when they are starting solids. It can really help with preventing constipation, but milk feed should still remain the main source of hydration. The last question I have today to answer is, when can I offer my baby grains? So I like to suggest to introduce more grains when baby is consuming closer to 3 meals a day. This is normally at around the 9-10 month mark, as there are just more nutrient dense foods that should take priority when they're only eating such small amounts. Grains can also be a little hard to digest, so that's why I always soak in sour grains, and I know that sounds really complicated, but it's actually so simple. You just add the grain to some warm water and put a dash of apple cider vinegar, leave it overnight, and then when you're going to cook it, you just rinse it off and cook it as you would. So grains are things like buckwheat, quinoa, lentils, rice, all that sort of thing. So those are all the top questions that I get asked. If there's anything else you're interested in finding out, you can find me at Mama's Menu on Instagram. I'm always more than happy to offer some guidance. So I really hope you learned something today and you feel empowered to feed your baby with some really nutrient dense foods. Thank you so much for watching.